Hi guys, Miss Gomez here. I'm gonna post a video of the bones for your review before your practical. So your practical is next week, it's due. It's my first time taking a video, so bear with me. I'm gonna go through them slowly and hopefully you can see what I'm talking about before you have to look at the pictures. So this is in real time, I'm not stopping and starting over, so if I look back and forth between things, that's why. But I definitely want to make sure that you're understanding what's going on. So this is from week 2. So we're gonna start at week 2 lab, which is the skull. Okay, so if you look at the whole thing is called the cranium. So the whole skull features and everything. Okay, as we go down, the frontal bone is going to be, think of hitting yourself in the forehead. So frontal bone, front of my head, I'm hitting myself in the forehead. Okay. The supraorbital foramen. So now a foramen means a hole. So anytime it says foramen, you're going to think hole. Okay. So above the eye, if you can look closely, okay, is a little indentation or a dot. Okay. So that is technically the supraorbital foramen. So this would be a hole that goes into your skull. Okay. And then your infraorbital foramen is going to be this hole down here. Okay, so they're holes, one obviously supra meaning above the orbit, and then infra meaning below. Okay, so those are those two spots when you're looking at your skull. Okay, as we go down, okay, we're looking next for, trying to read this, so bear with me. Your temporal bone is going to be on the side. Okay, so if you kind of follow, hopefully you can see all of my suture lines, which we're going to talk about, but the temporal bone is on the side of your head. Okay, so we're thinking kind of in this general, behind this bone, it's going to be more here. So if I'm touching my temple on the side of my head, this is going to be where my temporal bone is. Okay. Your next one is going to be, so temporal bone, again, side of the head, all through this area, okay? Next, we're moving on, and we're going to go to our parietal bone. So our parietal bone is on the side of my head, so if you can kind of see this line, and then this line that goes back, so parietal, you actually have 2 of them. So as we go down, these are both of my parietal bones. So this is a good way to look at, so frontal bone here, parietal bone, okay? And then the back, you can see the lines, hopefully. This is gonna be my occipital bone, okay? So my occipital bone is in the back, okay? So temporal is down lower, parietal, frontal, occipital. Okay, as we're looking at them. So some of the internal structures you're not going to be able to see off of here because I don't have a skeleton that's cut in half down a sagittal plane. So some of the terms on your list you're not going to be able to see on the actual skeleton. They're only going to be able to be seen through a picture. Okay, so just bear with me. So if there's something I don't touch on, make sure that you check it on a picture. So this little point that's sticking down right here is my external auditory meatus. Okay, the internal one you can't see on here because you'd have to cut this skull in half in a sagittal plane. Okay, my mastoid process, okay, is going to be this big, huge thing that sort of sticks out on the bottom. You can kind of feel it if you put your hand behind your ear. It sort of is a protuberance that sticks out. So it sits like little rockers, kind of, if you put the skull and rocked on it. Okay, so that is your mastoid process. Okay, with your occipital bone in the back, the occipital condyle is this big bump that sticks out. Okay, and you can feel that on the back of your head. So if you feel the back of your head, you can feel this sort of bony part that sticks out on the back of your head. Okay, foramen magnum. So foramen, again, we're talking a hole. So if I flip my skull upside down, this huge hole in the bottom, this is where my brain stem attaches. So my brain and spinal cord are going to attach through this hole. Okay, so magnum meaning obviously very large. This is my foramen magnum. Okay, my jugular foramen then, okay, is going to be up underneath. I'm going to have to open the bone for this, and I'm not going to do that yet. We're going to go into that in just a second, okay? My sutures, okay? My coronal suture is the suture that goes across in the coronal plane. So we're going across the skull. It's separating my frontal from my parietal bones, okay? My sagittal suture is the one that's going down the center of my skull. And now remember, this is where my different different skull bones are forming when you think of soft spots on babies' heads. Okay, so when babies come out of the womb, these bones have to be able to kind of overlap so that the head can come out. So then as we age, these will ossify and create what we call suture lines. Okay, so coronal suture, sagittal suture, whoops. Sorry, I'm reading through things. Lambdoidal suture goes along the back. Okay, so lambdoidal suture is this one that separates my parietal and my occipital bone. And then my squamous suture is on the side, if you can kind of follow the line here, which is separating my temporal bone from my parietal bone. So hopefully you saw all of those. Coronal, sagittal, lambdoidal, and squamous. Okay? So hopefully you're able to see all of those. Okay? As we continue down, okay, my maxilla. Okay, think maxilla is this part right here above my teeth. Okay, so as I'm looking, so anything that's touching above my teeth right here is my maxilla. Okay, and again, I showed you your infraorbital foramen, which is this part right here. Okay, and then as we go, okay, my I have maxillary sinus. I'm trying not to have to open the brain yet, or the skull yet. Sorry guys, I'm trying to read which ones I can hit on this part right here. Okay, inferior nasal concha is this part, so not the middle, okay, because the middle is my vomer bone, this part that sticks out right in here, okay? So my inferior nasal concha, okay? And then my last part of my maxilla is the maxillary sinus. Okay, so hopefully we're good on those, okay? So hopefully you're seeing everything correctly. Sorry, I'm jumping back and forth between two different things. All right, as I move forward, the maxillary sinus, again, is inside. You're not going to be able to see it because I can't cut my skull in half, okay? So I think that's most of my outer structures that we're looking at, okay? Oh, I take that back. Your mandible. Hello, my jaw, my mandible, my jaw, okay? So your mandible can detach. I don't have one that's detached right at the moment, okay? But my mandibular notch, okay, if you look up at the mandible, this sort of hooked structure right here is my mandibular notch, okay? My mandibular foramen is on the inside, so hopefully you can see right here, this little sort of hole on the inside. It's on the inside of the mandible, okay? My mental foramen is this hole here on the outside, okay? And then my ramus, body, and angle are just describing the parts of the mandible, okay? So the ramus is this portion, okay? Then I hit my angle, which is gonna be this. So ramus hits the angle and then goes into the body, okay? So it's just naming basically sections of the mandible, okay? Hopefully you're able to see all of these, okay? Your orbit is the socket, so think your eye socket, okay? Let's see where we're going from here. Your nasal bone, okay, is up here. Sorry, I'm all over the place, guys. Hopefully you're following with me. Zygomatic is going to be this bone. Okay, it goes into your zygomatic arch, which is sort of this bridge structure that comes across. Okay. I'm trying to see what I haven't hit. Again, vomer is the one that's inside the nose. Okay, so it's the bone that sits back that kind of splits the two things. Temporal process is going to be the part that sticks out on the side. Okay, so your temporal bone. Sort of, you have your zygomatic arch, and then the part that sticks out from your temporal bone is your temporal process. Okay, I think I've hit on almost everything that is on the outside, in referencing the outside of the skull. So then when you open it, okay, so when you open and take the lid off, we see the inside. Okay, in here you have sphenoid and ethmoid bones. Okay, so your sphenoid, think wings. Okay, so it sort of forms a bat type structure in the center. Hopefully you're able to see this. Okay, and you have greater and lesser wings. Okay, your optic foramen is going to be up towards the front. Okay, so it's sort of in this area here where your optic nerve is going to come through. Let's see. Your sella turica is in the center, so it's this area in here. Your sphenoidal sinus is this hole in here, okay, that kind of goes through. Your foramen, one second. Your foramen ovale, okay, is this one down here. This circular hole right here. And I think that's all of them that we hit. Your jugular foramen come back here off of your foramen magnum. Okay, so again, anything that's a foramen is a hole. Okay, anything that's a foramen is a hole. Your ethmoid bone, okay, think this, see this little like part that sticks out right here? This is where your ethmoid bone is, okay? Your olfactory foramina are all the little dots. In the picture it's easy to see, but there's little dots that would be coming in through this bone. Again, they would be little tiny holes. And then cristagalli, think of it as like the peak, okay? It's the peak part that's coming. And again, this is harder to see on the actual skull than it is picture, so remember that. Okay, we talked about everything. The cribriform plate is near the bottom of it, okay? So as this sort of branches out, as you can see, it sort of comes down, and here is the cribriform plate, okay? And I think that's everything that you can see from the section that we're looking at. So I think that I've hit on all of the skull parts. Hopefully that helped you a little bit, because when you take your practical, it's going to be a bone like this. It's not going to be a picture, and they're going to be a number on the part. Okay, if you have a question about where it's specifically pointing to, make sure you post that to me, okay? Send me a picture and tell me, so that I know that you don't understand what the question is asking, and then I can go back in and check what you wrote, okay? So this is part 1. I'm gonna do the rest of the bones, but this is from week 2, so this is the list and the pictures from week 2 where they went over the skull. So hopefully this helps you in preparing it. And again, your practical isn't until next week. but I wanted to get this up in case you're studying, okay? So I will be back with the rest of the bones.